A vaccine shortage during Taiwan's biggest COVID outbreak has led to a public outcry for vaccines.
That has led people like business tycoon Foxconn founder Terry Guo to volunteer to buy them for Taiwan and the government to roll out a mass vaccination plan.
Later in the show, Staś Butler tells us all about Taiwan's domestic vaccines, which are different from all the big-name COVID-19 vaccines out there. He'll be telling us how they work.
And in Hashtag Taiwan, Leslie tells you how an anonymous donor lifted the spirits of some local medical workers. This is Taiwan Insider. We saw a dip in COVID cases earlier this week, but on Wednesday and Thursday, the numbers went up again. Officials are telling people not to travel for the Dragon Boat Festival holiday, which falls on June 14th. And to be careful even when you're grocery shopping.
The three most important things people can do to stop the spread of COVID-19 is wear masks, wash your hands often, and stay home. But you can only stay home for so long before the fridge and pantry run empty. People eventually have to step out to buy food. One of the most popular places for buying groceries in Taiwan is traditional markets. The government has asked people not to frequent traditional markets in an effort to minimize crowding, but that's been somewhat ineffective. Local governments have started implementing tighter prevention measures at traditional markets. In southern Taiwan's Kaohsiung, shoppers are asked to leave their contact information when they enter traditional markets. Furthermore, people are advised to go to traditional markets on certain days based on the last digit of their national ID number. Officials say these restrictions will not be strictly enforced right away. However, they will be beginning June 4th. How have these restrictions impacted markets? Well, one shopper tells us she'll stock up more each trip. And one vendor says his business has dropped by 80 to 90%. It's hard to regulate traditional markets given that most of them are outdoors. People can sneak in or just ignore signage and barge past barricades. Over the past 3 weeks, data has shown that Taiwan's daily number of newly confirmed COVID-19 cases may have begun easing. However, Health Minister Chen Shizhong says now is not the time to get complacent. It's more important than ever to remain vigilant if Taiwan is to get this outbreak under control.
As Taiwan faces its biggest outbreak yet, people become anxious about our vaccine shortage. Now, Andrew tells us how private entities are looking to fill the gap.
When you hear the name of one of Taiwan's richest tycoons, Terry Guo, you might think of Foxconn, the company he founded, which makes your iPhone. Well, now he's trying to do something that Taiwan's government hasn't been able to do: buy 5 million doses of a vaccine made by a German company called BioNTech. Now, Taiwan's government tried to buy them, but they say that they were blocked by China. Perhaps Terry Guo will have better luck? Well, what's interesting is up until this past week, he and other private entities in Taiwan weren't even allowed to buy foreign vaccines.
A lot of private entities want to buy vaccines for Taiwan. That's with the country facing a shortage during its biggest outbreak since the pandemic began. So far, Taiwan has imported less than 1 million vaccines for its population of over 23 million. And just over 2% have been vaccinated. Initially, the government was reluctant to let the private sector order vaccines, but in the face of mounting criticism about the shortage, officials have changed their tune. An expert pointed out that the Pharmaceutical Affairs Act, Article 48.2, says when there is an urgent public health need, specific drugs can be imported and approved on a case-by-case basis. There's no rule that the central government must sign these contracts. Health Minister Chen Shizhong explains the government's stance. The reason the government said that it needs to sign the contracts is because the process is very complicated. When the government helps out by signing the contracts, everyone will have legal protection. But if people want to sign contracts on their own, as long as the process is legal, we can discuss it. I hope that the government can take responsibility for these matters as we can provide more convenient and accessible channels for distribution. We will do our best to find a way to resolve these matters legally. Chen said that private entities must also apply for emergency use authorization and make sure that the source of the vaccines and technical information meets the CECC's requirements. He says most vaccine companies sign contracts with governments or work with COVAX, the global initiative providing equal access to COVID vaccines. But since people have their own channels of access, Taiwan's government is willing to monitor the process to make sure nothing goes wrong. There are a few entities looking to buy vaccines for Taiwan, including the large Buddhist organization Foxconn, and also, as you mentioned, business tycoon Terry Kuo. Now, Andrew, what do you think of Terry Kuo's plan to buy 5 million BioNTech vaccines for Taiwan?
Well, Natalie, I think it's a really compelling idea. If Taiwan's government's having trouble due to opposition from China, then let's see who else we have that can help us get the job done. And I think Terry Kuo is a really compelling choice because he has a lot of manufacturing plants in China making iPhones. He's got a great relationship with China. Of course, he also has great relationships with manufacturers in Europe. So, if Terry Kuo can get the job done, I say the more the merrier. What about you?
Well, I totally agree with you. If he has the connections and savvy to make the deal, then the more power to him. And if he's looking to run for president again, I think he's going to win a lot of votes this way.
All right, let's take stock once again of how many vaccine doses Taiwan has gotten so far. Well, it's only gotten less than 1 million vaccines. Now, it's purchased about 20 million foreign vaccines, but that's less than half of what it needs for its entire population, and we're still waiting for those vaccines to arrive. Now, what about domestic vaccines? Well, Staś Butler has the details in today's Taiwan Explained.
Taiwan has ordered 5 million doses from Medigen Vaccine Biologics Corporation and 5 million doses from United Biomedical. Both contracts are flexible, though, meaning that both numbers could increase to 10 million, making a total of 20 million vaccine doses. So what kind of vaccine is it? Well, at the moment, there are 4 main vaccine types in use around the world. One uses little fragments of mRNA. That type includes the Pfizer-BioNTech vaccine and the Moderna vaccine. Another type is viral vector vaccines, like the Oxford-AstraZeneca vaccine. The third type is the traditional inactivated pathogen vaccines you would have learned about at school. Those include the Sinovac and Sinopharm vaccines. That brings us to the fourth and final type, the kind the Taiwanese manufacturers are developing, protein subunit vaccines. How do they work? Protein subunit vaccines take little parts of the virus and use those to trigger immunity. For COVID-19, that means harvesting the spike proteins from the surface of the virus. This kind of vaccine is incapable of causing the disease because the spike proteins on their own can't infect human cells. That means they're very safe. The technology is already well established, and scientists have used it to make a highly safe and effective vaccine for hepatitis B. One drawback is that using small parts of the virus rather than the whole thing means sometimes the body doesn't react strongly to the vaccine. That means the immune response is sometimes weaker. Luckily, there's a way around this, which involves adding a thing called an adjuvant to make the immune system respond more strongly. So, how is development going for these vaccines? Both manufacturers are finishing up Phase 2 trials with more than 4,000 volunteers taking part in each study. And both companies hope to apply for emergency use authorization in June. United Biomedical says it's confident it can start supplying vaccines in July. So if all goes to plan, we should have at least one Taiwan-made vaccine by the end of next month.
While we're waiting for more information on how safe and effective domestic vaccines are, people are hoping for the delivery of more foreign vaccines. Now, about 2 million are scheduled to come this month, and there is a mass vaccination campaign underway.
Health Minister Chen Shizhong has said words that people have been waiting weeks to hear. Mass vaccination for COVID-19 could begin soon. 2 million doses of COVID-19 vaccine are set to arrive at the end of the month. Hundreds of clinics and a range of halls and sporting venues are going to be turned into mass vaccination sites. The plan is to give 140,000 jabs on average per day, a pace that would see close to 1 million people receiving 1 dose per week. This initial shipment of 2 million doses will only be enough to make an initial dent, but it will at least be the start of a return to normal life.
I tell you, Taiwan's medical workers really have been working hard lately, so of course we're thinking about them. Now, up next in Hashtag Taiwan, Leslie Liao has a story about a kind gesture for medical workers from an anonymous Good Samaritan.
This is Tiffany. She's a friend of mine and she owns a dessert shop in Taipei City. In fact, you can say Tiffany is a friend of RTI because she and her shop have been featured on Andrew Ryan's program. Tiffany's shop specializes in shaved ice, and boy, they are delicious. That's just my opinion though, and no, this hashtag won't be dedicated to endorsing her desserts, even though once again, they are delicious. Tiffany shared a heartwarming story that popped up on my social media feed that I just had to share. The story goes like this. Tiffany and her sister, who also owns a dessert shop, collaborated and donated 100 desserts to medical workers at Far Eastern Memorial Hospital in New Taipei City last Friday. 4 days later, on Tuesday, Tiffany said a customer passing by her shop beckoned one of the shopkeepers outside. Just as a reminder, restaurants all over Taiwan are not allowed to have dine-in customers. Restaurants can only offer delivery or takeout. That's why the customer didn't go inside her store. When Tiffany's employee stepped outside, the customer handed her a wad of cash and told them to use it to buy desserts for more frontline pandemic personnel. Tiffany was moved by this turn of events, so much so that she included 3 crying emojis. She also threw in a slew of hashtags like hashtag Taiwan is full of warmth, hashtag thank you to this anonymous customer, hashtag another round for frontline medical workers, hashtag keep it up Taiwan, hashtag keep it up medical workers, and hashtag keep the kindness going. I followed up with Tiffany in a text interview. She's a little camera shy. Apparently, the anonymous customer told Tiffany's shop that it could use the money to give desserts to any frontline pandemic workers like firefighters. It didn't necessarily have to go to medical workers. She said that customer donated enough to buy at least 200 desserts. Tiffany said what moved her the most was the customer's willingness to entrust their money to her store to carry out the task. She said that the food and beverage industry is taking a big hit during this pandemic, with her store seeing a 50 to 60% drop in sales. So I think it says a lot that Tiffany is willing to donate desserts to medical staff at a time when her shop is struggling. Tiffany said she hopes that her desserts can bring a little joy to busy medical workers. And I think that goes back to her hashtag, keep the kindness going. There's an understanding that even though her shop is struggling, medical workers on the front line are having a harder time fighting COVID. And during a time when people are out here arguing about vaccinations, prevention efforts, pandemic alerts, stay-at-home orders, mutations, cluster infections, infection hotspots, rapid tests, PCR tests, it's comforting to hear about nice people out here doing nice things. And that's the exact kind of energy that makes me think, we're gonna be okay.
Now, before we leave you today, a look at some of the other news stories on our radar.
Taiwan's outlying islands are battening down the hatches as COVID-19 continues to spread around Taiwan proper. The Penghu Islands, which have already recorded cases of COVID-19, are requiring rapid testing for arrivals. Meanwhile, those heading to Jinmen or Mazu must fill out health declarations before boarding flights. People with symptoms will be denied boarding, while those who have had symptoms recently will have to undergo a rapid test at the airport. A bipartisan group of U.S. lawmakers has introduced the Taiwan Diplomatic Review Act. The act would make the U.S. envoy to Taiwan a Senate-confirmed position, rename Taiwan's office in the U.S. as the Taiwan Representative Office, and create a special class of visas for Taiwanese diplomats, who now use investor visas to stay in the U.S. The annual plum rains have arrived, providing some relief to Taiwan's worst drought in decades. Reservoirs in central Taiwan have benefited in particular, with millions of tons of water added to dwindling supplies. A container ship has crashed into a crane at the port of Kaohsiung in southern Taiwan, causing 2 cranes to collapse and sending freight containers tumbling. 1 person was injured. 2 people trapped in the aftermath of the collision have since been freed.
Today, our final question, what would you like to give Taiwan's frontline medical workers? Andrew?
I think the obvious answer is a day off. I mean, if I could give them a month or a year off, I would do that too.
A day off. I'm sure that's what they need most. And you, Leslie?
So guys, more than anything, I want to give medical personnel comfy beds. One of the things I have to do for Hashtag Taiwan is scroll through social media a lot, and a lot of the pictures that come up of exhausted social media workers are them sleeping on hospital floors. And it's not just medical workers, firefighters too. I can't imagine working, at max capacity for 12 hours a day only to have to sleep on a hard floor. That just sounds so unappetizing to me. If anything, I think they deserve the best of rest, and I wish I could really give them a nice, comfy bed.
comfy beds. That's really thoughtful. And I would give them massage chairs. They've been taking really good care of other people and they could use some self-care. That's it for today's Taiwan Insider. I am Natalie Tso.
I'm Andrew Ryan. Take care, everybody.
And I'm Leslie Liao. Think happy thoughts, guys.
Be sure to follow us on social media. Leave a comment below. We would love to hear from you. See you next week.